My name is Michael Levy. I'm an associate professor of neurology at Massachusetts General Hospital and Harvard Medical School. And I've been practicing neuroimmunology for about 15 years with a special interest in patients who have neuromyelitis optica. Neuromyelitis optica spectrum disorder, or neuromyelitis optica, or NMO, is a rare demyelinating disease of the central nervous system. Has a lot of features similar to multiple sclerosis in that it's relapsing attacks by the immune system onto the nervous system. If it attacks the optic nerve, it causes blindness. If it attacks the spinal cord, it causes weakness, sensory loss, bowel and bladder dysfunction. The attacks occur on average once or twice a year, and they can be very devastating because the healing is very poor after each attack. And so patients accrue disability over time if attacks continue. There are 3 currently FDA-approved drugs to prevent relapses in this disease. So once you're brought to our attention, correctly diagnosed, we can put you on a preventive medication so you don't have any future attacks. All of the symptoms from prior attacks can persist, and often they do, and the healing is poor, and so patients have to, we have to figure out ways of helping patients deal with those symptoms. The majority of patients are diagnosed by neurologists or ophthalmologists, and it's after a presentation of optic neuritis or vision loss, or mobility issues, bowel bladder dysfunction, and an MRI that shows a lesion in the spinal cord. I do want to emphasize NMO is rare, maybe one or two people per 100,000 in the population. So it's not like everyone with back pain needs a blood test, but certainly anyone with a spinal cord lesion on the MRI or blindness in one eye that's sudden, people with a background history of lupus or Sjogren's, those are major clues to the diagnosis of NMO. And I think the awareness is improving. I used to get patients who were undiagnosed for 4 years. That was the average. Now we've cut that down to 9 months. So there's still work to be done. This is an app. It's an app on your phone that's designed to capture your neurological function on a regular basis. Rather than just coming to my clinic once or twice a year where I can examine you, the phone can actually pick up a lot of information about your neurological function, your vision, your gait, your cognitive function, and your coordination. Can detect all of those things on a regular basis as you interact with your phone, and then we can get that data on a regular basis. So this app is a test of that capability. There are several apps that are currently in development. Some are more targeted towards MS, and this one came from the MS world. It was called NMOSDCoPilot, and now they're looking into developing it for NMO, and this one's called NMOSDCoPilot. And there are other companies that are developing apps as well. There are some native functions on your phone right now through Apple Mobility that collect a lot of that information as well. The study that was presented compares what patients feel like is useful in this app with what doctors feel like may be useful. There was a strong concordance. There was a feeling that the data that we are going to collect in the study that is now ongoing is going to be useful for monitoring neurological function in NMOSD. Well, it's a study right now, so it's not being used in a clinical scenario, but what it does is on a monthly basis, you interact with the app. It asks you to walk a kilometer. It asks you to read letters that are low contrast. So this is gray figures on a white background. It's difficult if you've had optic neuritis. It asks you to do some coordination games, and there's a cognitive assessment and then some surveys. And then what we'll do on a 6-monthly basis is we'll examine patients in the lab. And if the dysfunction that's picked up on the phone accurately matches the dysfunction we can examine in the clinic, then we know that the app is faithful and it's reliable. The trial is in progress. It's about 1/5 enrolled. At the end of the study, after we hopefully confirm that the app is useful, then we can implement it in clinical practice. And then patients will interact with their app. I will get a regular reading, and if there's a abnormality or perhaps a decline in function over time, this is something that we can share with patients in clinic. Because what I found is in clinic, sometimes patients perform particularly well one day, but they may have dysfunction the rest of the 6 months. And so this allows us to capture all of that dysfunction over the previous 6 months rather than just looking at one snapshot in time. These apps give us information about your function that we can't get on a regular basis. You're with your phone all day, every day, and it's collecting information about you that we would like to know. Even when we see you once or twice a year, we'd like to know what you were like the previous 6 months, 12 months, and the phone knows. And so we can get that data from your phone and then have a meaningful conversation in the clinic about how your function has been over the last 6, 12 months. So your phone does collect a lot of information on a passive basis. As you walk with your phone right now, it's collecting that data. That is not the data that we are collecting. We're not allowed to collect that data. There are privacy issues regarding collecting data from your phone that you don't know about. What we're doing is we're only using active data. This is information that you're inputting into the app and then giving us permission to access. So privacy protections are guaranteed with this app. I think one of the major issues is diagnosis. We have a wonderful blood test, but if you don't get that blood test, you'll never know that your patient has NMO. And so it's really about awareness, when to send the blood test, who to send the blood test on, and how to interpret it. And if your patient does have NMO, there are dedicated NMO centers that can help advise them on treatments, and then we can return the patient to the referring neurologist to continue the management on an ongoing basis. There's also an issue about when to recognize that the drug is failing, because patients will have ongoing symptoms even while they're on a preventive drug, but those symptoms were due to previous attacks and are not expected to improve with preventive therapy. And so educating on that topic is, I think, also very important.